In the spring of 2020, UNT Health Science Center issued a university-wide statement on DEI. The library determined that an evaluation of our collections was in order. In our evaluation, we found that few resources were diverse enough and that there was a lack of diversity in medical images. Recognizing a bias and lack of information in our collection, the library decided to address the issue through policy adjustments and direct communications with our vendors. Lack of diversity in our collection stemmed from a CD policy which did not reflect DEI as a purchasing or renewal factor, and lack of communication about our expectations to our vendors. Our objectives were to gather data on HSC's population demographic to move the collection towards reflecting the population we serve, to adjust our CD policy to include DEI as a purchasing criteria, to clearly communicate our expectations to our vendors, and then to evaluate the effect, if any, our changes had on the collection. To reach our objectives, we immediately made changes to the CD policy to include DEI as a purchasing requirement. I then drafted a letter that was sent to all of our vendors during renewal negotiations stating our expectations. We then expanded our dialogue with vendors based on their responses to our letter, and we included the letter to anyone that we were considering entering into business with as part of our new standard practice. Our vendors' response was extremely positive. We received 11 responses with information about diversity in their collections and their own initiatives. Our Wiley rep shared our letter with other libraries with similar needs and interests, and a potential vendor sent us a letter of thanks because he was prepared with a DEI statement when asked because of our communication. Overall, the effect on our collection has been positive. We have seen an increase in relevant communications from vendors which highlight DEI titles and collections. We were able to add $5,500 in DEI ebook titles. We added a new database which focused on medical dermatological images at a null cost by renegotiating our subscriptions based on DEI as a purchasing criteria. And we regularly receive notifications from our vendor reps when DEI items are added to our current subscriptions, which allows us to leverage these titles within our community. Moving forward, we expect the diversity in our collection to increase based on our new expectations and levels of vendor communication.